Did you guys know that 10 million children and adolescents suffer from a diagnosable psychiatric disorder? Or that serious emotional disturbances affect 1 in every 10 young people, and two-thirds of those children are not getting the help that they need? Or how about that 1 of every 5 children with a psychiatric illness gets treated, and fewer than 10% of American public schools have a comprehensive mental health service? Mental health is a stigmatized discipline in public health. Society has given it the cold shoulder, mostly due to lack of information. The most common forms of mental unwellness in children include anxiety disorders, mood disorders, eating disorders, and psychotic disorders, mostly stemming from regular old stress. 8% of teens ages 13 through 18 have an anxiety disorder, and most symptoms emerge around the age of 6 and continue throughout adolescence. My recommendations to solve this is to increase the availability of counseling to children at school, and to implement programs in middle schools that are targeted at reducing stress levels of their students, as well as simultaneously improving their educational progress, and allowing them to eliminate the sense of being overwhelmed and left alone with those feelings from schoolwork as well as the child's social environment. Many factors contribute to this problem among children. Stress can lead to nightmares, picking up new habits, or in older children lying and bullying, and lots of changes in academic performances. And all it really takes to cope with this are rest from stressors, relief, and good nutrition. The main source of this problem is the lack of availability of resources and intervention programs. There are simply not enough resources in the school to reach each student that needs counseling and to help them deal with their internal psychosocial problems. Stress-related and anxiety disorders among children are mostly going undetected, potentially leading to other causes, such as drug abuse and misuse, emotional mood disorders, heart disease, asthma, and diabetes. 20% of children need active mental health interventions, and only 21% of those children with mental health problems actually receive mental health services. This is a problem because mental health, especially in children, and especially dealing with stress, is in the top 10 health problems among individuals. So the current policies, why aren't they helping? Well, there's no clear classification criteria for disabilities, and as a result, disabilities classified in the educational arena as emotionally disturbed do not correspond well with psychiatric disorders. Children are therefore misdiagnosed due to lack of clear classifications and thus are placed in special education counseling that doesn't actually coincide with their needs. Schools are actually only required to provide special education services to all eligible students with a disability, but federal dollars only finance 8% of state special education services. Education and mental health policies can be better designed to not only improve the mental health outcomes of children, but also enhance their academic success. I think by implementing more concentrated, individualized education programs, addressing social and emotional disorders, while also introducing mental health service treatments delivered by school staff members, that a lot of these problems could be fixed. This would alleviate the cost of bringing in professionals, and since students would know the staff member in charge of their counseling, there would be more trust from the beginning to allow the child to feel more comfortable enough to confide in the staff member and open up about what they're dealing with. Students are already highly influenced by their environments at such a young age, so promoting social and emotional development into school curriculums would eliminate the feelings of a child being alone with their problems. Before any changes can occur, we need to reduce the competition of the scarce resources, include policymakers, taxpayers, and local advocates of pediatric mental health to help promote the need for support through education and through financial support. There is a need for change in the current policy system regarding the mental health of children. Children are clearly suffering, and most are going unresolved. However, most cases can be resolved if the right policy is in place to address the needs of all children, especially during their critical developmental ages. I suggest eliminating the competition of the scarcity of resources by getting more people in a higher authority to care about this huge problem that unfortunately slides under the radar far too often. I have personally struggled with terrible stress management throughout high school and college thus far, but I strongly believe that if I were to have participated in a program that instructed me on how to properly deal with stress and school-related anxiety at a younger age, it would not be such a problem for me now. The stigma associated with mental health should be completely wiped away so that children in need are able to receive the help that they need before other serious health problems surface that could otherwise be preventable. Children are the future, so let's give their minds some rest and eliminate their stress.